and return today with an appetite for more. Yesterday, we heard many mentions of blood throughout the presentations in Deb Armbruster's review of the Senegal meeting, in Dr. Weidemer's mention of administrative factors associated with avoidable death from obstetric hemorrhage. So today, we will dive deeper into the issue, looking at international guidance and the experience of Rwanda, the major government efforts that have been undertaken, and some interesting innovations used to tackle this issue. So I'll now introduce our first speaker, Katari Swaibu. Katari Swaibu is head of the Rwanda National Blood Services, where he drives and champions Rwanda's effort to improve blood safety. He's played pivotal roles in the development of Rwanda's national guidelines and policies on blood transfusion. Please go ahead, Katari.
So Laura, this is Christina Potus. We're not seeing Katari in the meeting right now. I'm not sure why. We're trying to connect with him over email to bring him in, but okay, would it be okay if we skip to Yuyun's?
Let's move along. Okay, then I'd like to present Dr. Yuyun Mariyonginsi. She is the team lead for blood and other products of human origin, technical standards and specifications unit of the Health Products Policy and Standards Development at the World Health Organization. She's a committee member of the Partnership Training Network of the APEC Blood Supply Chain Forum, past regional director of the International Society of Blood Transfusion for Southeast Asia region, and the chair for the Indonesian National Blood Services Committee. As you see, Dr. Yuyun has a lot of expertise, and she will share with us some information on guidelines.
Okay, so thank you, Laura, for introducing me. Good morning, good afternoon, good evening, everyone. It is my pleasure to join the PPH COP annual meeting and also to share the WHO information on the action framework and guidance on maintaining blood supply during COVID-19 pandemic. Next slide, please.
I just resent the link.
Okay, thank you.
Yeah, so this is an outline of my talk. So I will try to explain the action framework, the guidance, and also the collection of convalescent plasma. Also, I hope I can finish on time. Next slide, please. So, dear participants, in 2014, WHO has issued the WHA resolutions that urge member states to ensure availability, safety, and quality of blood products. However, the Global Database on Blood Safety 2015 point a number of inadequacies related to the supply and safety of blood. Meanwhile, I think we are aware that blood services is often play an important role during emergency situations, such as during the natural disaster, conflict situation, and also infectious disease outbreaks. But unfortunately, in some countries, blood supply during this situation is always experiences problem. So emergency preparedness in blood services must be done to guarantee the blood supply safety and quality. Next slide, please. In response to these situations, the WHO has developed several resolutions as well as guidance documents. And countries that implement these resolutions and guidance are making progress in providing safe blood. But progress in strengthening national blood system has been slow in many low to medium income countries. So there is a need to push for implementation of WHO guidance. Next slide, please. Yeah. So in 2019, so WHO developed the action framework to advance universal access to safe, effective, and quality assured blood products to be implemented in the next 4 years. And this action framework was launched on 27th of February 2020. The action framework is actually a strategic direction to global efforts to address present barriers to safe blood. And this document responds to WHO resolutions on availability, safety, and quality of blood products, and also has been aligned with 13th WHO General Program Book, as well as with the strategic plan. So this is also as an implementation of the resolutions, goals, and strategies, and also to be used for partnership and fundraising. So we expect that this document also can help WHO to achieve the 3 billion strategic priorities. Next slide, please. So we found out from the data there are at least 6 challenges in blood services. So one is inadequacy in policy, regulations, governance, and financing. The data shows that only 60 to 70% member states has a blood policy legislation oversight system in place. And then the second challenge is insufficient supply of blood products. The data showed that there are around 66 member states with donation rate less than 10 per 1,000 population. And then some countries also still face the deficiency in safety, effectiveness, and quality. So the data again shows that in some LIMICS country, 80% of donated blood was tested. Another challenge is lack of availability of plasma-derived medicinal products. This because of the limited use of blood components and also low volume of plasma as well as poor quality of plasma. And then another challenge is patient blood management is not in place. So this is lead to the suboptimal clinical practices. And again, as I mentioned before, that poor access to blood during emergency because there is no blood preparedness system during emergency situations. Next slide, please. So in this document, we propose 6 actions, which is summarized into 6 strategic objectives, which are appropriately structured, well coordinated, and sustainably resourced national blood system should be in place, as well as appropriate national framework of regulatory controls, and also functioning and efficiently managed blood services should be in place, effective implementation of blood management, followed by effective surveillance, hemovigilance, and pharmacovigilance. And also member states should improve the partnership, collaboration, and information exchange. Next slide, please. So in this document, we stated the activities in forthcoming years, which are the development of some guidelines. So we identified there are around 6 guidelines need to be established. And this year we try to establish the guidance on centralization of blood testing and processing to achieve the standardization of blood quality. And also we are working to develop the white paper on plasma-derived medicinal products. And another activity is technical assistance in the form of workshop or webinar, training, site visit, or site assistance. Next slide, please. Okay, sorry. So in response to COVID-19 pandemic, where it impact into blood supply, in March 2020, WHO has issued the first interim guidance, which now has been updated to respond to regional requests on more detailed guidance, as well as on collection of convalescent plasma for of COVID-19. Because as you know that currently there is no effective medicine for COVID-19, and also we haven't found any vaccine. So more and more member states try to use the COVID-19 convalescent plasma to treat the severe cases of COVID-19. And this interim guidance actually has already been updated, and the new one has already been published in 10 of July 2020, and you can access this document into the link that showed in this slide. Next slide, please. So this is the content of the interim guidance, and I will try to explain one by one. Next slide, please. So even though transmission of SARS-CoV-2 has not been reported, but theoretically is possible, warranting reasonable precautions. And the pandemic impacts on reduced donation and collection, for example, because of the long period of lockdown, which finally impact on blood supplies. And appropriate action to mitigate harms require data-driven risk assessment in the context of public health. And moreover, a national approach should be adopted for coherence and coordination. And blood services should be included in the national outbreak response, and action taken should take into consideration of, for example, the COVID-19 spread, level of community circulation, local epidemiology, risk of transmission in the context of overall burden disease, quality of healthcare system, public health response, blood supply sufficiency, operational impacts, as well as cost effectiveness of intervention relative to overall country situations. Next slide, please. There are at least 5 efforts need to be done to mitigate the potential risk of transfusion-transmitted SARS-CoV-2. So the first effort, for example, is the educating the donors on risk factors for self-deferral and actively defer donor for risk factors. And then current pre-donation criteria should be able to exclude symptomatic individuals. And also the blood centers should ask donors to report post-donation illness consistent with COVID-19. And during widespread community transmission, donor restriction may need to be evaluated and reduced. And the last effort is, which is also important, is the hemovigilance system should be in place. So currently, testing donors or donation for SARS-CoV-19 RNA is not presently indicated in the absence of documented transfusion transmission. And also the pathogen reduction technology is not recommended where it is not already in place, and no presumed risk of transmission from plasma derivatives. Next slide, please. Mitigation the risk of staff and donor exposure to SARS-CoV-2 should also be implemented, for example, by screening for COVID-19 related symptoms, wearing masks and gloves, as well as practicing social distancing and regular environment decontamination. Information and education need to be done for public to gaining confidence to continue donating blood. And crowding of donors and staff should be avoided. Ensure safety of donation process, and staff education on infection prevention and control also should be run. Next slide, please. Efforts to mitigate the impact of reduced availability of blood donors should be done, for example, by preparing in advance how best to respond to a shortfall in donation, ensure clear communication, monitor donation number for rapid response to evolving shortages, cooperate closely with the hospital on blood inventories, address barriers to blood collection and consideration of importing blood component from less affected areas. Next slide, please. The demand for transfusion may decrease because most of hospitals are focused on treating the COVID-19 patients, and elective surgeries also may be deferred. However, transfusion remains necessary for emergency situations. For example, for postpartum bleeding, and also there is a need for transfusion to support COVID-19 with sepsis cases. And good patient management should also not be forgotten, and coordination with transfusing physician can optimize blood use to minimize demand. Next slide, please. Supplies of critical materials such as blood bag and also blood group reagent, and also the transfusion transmitted infection detection reagent and equipment need to be ensured, as they may be disrupted due to border disclosures, transport restriction, and disrupted production. So the blood service must take steps to ensure continuity of supplies. Next slide, please. The use of COVID-19 convalescent plasma has actually recognized by WHO as an experimental therapy, and clinical study of the CCP may include randomized control trials. Collection of CCP should only be done at blood service that can assure product quality with criteria for acceptance of CCP donors in place. And preparation and use of CCP should meet ethical criteria for human experimentation in regards to both donors and recipients. Plasmapheresis is recommended to be used for the CCP collection. So this one is actually to avoid unnecessary red cell loss and also to optimize the plasma volume that can be obtained. And outcome therapy need to be reported. Next slide, please. Okay, further information on the convalescent plasma use can be referred to WHO Blood Regulator Network recommendation, which can be accessed to the link shown in this slide. And also several protocols of CCP clinical studies can be found on the ISPT website. However, WHO does not endorse any of the statements or protocols listed in the ISBT website. Next slide, please. I think this is the last slide, so thank you for your attention. Back to you, Laura.
Thank you so much, Dr. Yun. Thank you for orienting us to all of these guidelines, and also you've given us a lot to think about with regards to blood supply during our current pandemic. As a reminder to participants, all of the links that were in Dr. Yun's presentation will be available on the website, so you can look to those documents yourself. I'd now like to pass on to Dr. Katari Swaibu, the head of the Rwanda National Blood Services. Dr. Katari? Okay. It seems as though we might be having connection issues. So instead, let's keep moving forward. So next, I would like to introduce Joseph Nagijimana. Joseph leads the Rwandan team at Zipline, which is a drone delivery service company that specializes in on-demand delivery of blood and other vital medical supplies to health facilities. Prior to joining Zipline, he received the prestigious Global Health Corps Fellowship. Please go ahead, Joseph.
Thank you, Laura, for the introduction. Next slide, please. This is Alice. Alice was pregnant 2 years ago with her first child. She went to one of the hospitals in rural Rwanda to deliver her baby. Everything was going well with her delivery until all of a sudden, she started to bleed. Her doctors knew immediately that she was going to need a blood transfusion. They checked their stock, but they didn't have enough of her blood type, so they rushed to place an emergency order. This hospital is located 2 hours from the nearest bank, and the roads that are dirt that sometimes get slippery, especially during the winter. Despite all those challenges, the blood was delivered within 30 minutes, and the doctors were able to stabilize Alice. And later, she went home with this beautiful little boy. Next slide, please. Next slide.
Do you want
Next
the slide
slide,
with the
please.
baby here? Okay. One more.
Yes, one more.
Thanks.
The blood Alice needed, the blood that saved her life, was delivered using a small autonomous aircraft that we call a Zip. Later, Alice was curious to understand what happened, and she came to one of our distribution centers to meet our team. And this is what she had to say. Next slide, please.
I used to see the zipline drone fly and people gathering around to watch. I would find it funny and think to myself, they must be mad, until the same drone brought blood that saved my life.
Next slide. Zipline is a drone delivery service. Next, we deliver blood, emergency vaccines, and pharmaceuticals. Next, please. In 2016, through a partnership with Zipline, Rwanda became the first country in the world to operate a drone delivery service at national scale. Now more countries like Ghana, even the US, have started following the example. Let's take a look at how this works. Next slide, please.
Supply chains around the world often consist of complex models, long procurement times, and a lack of logistics infrastructure that limit access to medical products. Emergency situations occur frequently where this access can mean life. or death. That's when Zipline can really help. Zipline operates 7 days a week, day and night, to quickly deliver life-saving products to hospitals around the country. With our zips, medical supplies can be quickly delivered in under an hour. Placing an order with Zipline is easy. Once you order, our fulfillment operation team will begin processing your order immediately. For safety and quality assurance, the operator performs a visual inspection to ensure that they are packed to meet high quality standards. The operator securely wraps and packs the products. It is then handed off to our flight operation team to prepare for launch. Our fleet of zips are always standing by to fulfill numerous orders simultaneously. Our zips fly in all types of weather, including heavy wind and rain. After putting the package in the zip, we perform a safety check. The zip is then launched, flying by itself at 120 kilometers per hour to your delivery site. Once the zip is close by to the hospital, you will receive a message to stand by at the drop site. The zip will descend and drop the package via parachute. After delivering your package, the zip quickly returns to our distribution center to get ready for the next order. Come rain or shine, Zipline is here to support you and your patients. We look forward to working with you.
Next slide, please. So the Rwandan team you just saw is achieving something no other healthcare system in the world has been able to achieve today. And to understand how, next slide, please. Let's talk about blood. Blood is precious. It's also logistically complicated and way more expensive than you would imagine. Some blood products like platelets have a very short shelf life, and there are so many different blood types, like many people in the audience know, many of which are very rare. The one key metric that every health system in the world tracks is how much of their blood supply expires before it can be used. The Western countries work hard and spend a lot of money and achieve less than 10% of waste rates. But the team you just saw in Rwanda, while delivering over 56,000 units of blood, have managed to achieve a waste rate of 0.066%. Next slide. Next. But these are just still numbers. What matters is the impact on people's health, the impact on maternal mortality. In a study that was done last year, covering 2 hospitals Zipline serves in Rwanda, over a period of 7 months, they managed to achieve a maternity mortality rate of 0. These are some of the mothers that received blood delivered by Zipline with their babies. This is an incredible achievement for Rwanda, and we are proud to have played a small but vital part in it. Next slide, please. Rwanda has shown how innovation in healthcare systems can transform fundamentally what we think is possible. other countries have already started following this example of how to solve the problem of access to blood and other medical supplies. With our operations in Rwanda and now in Ghana and the US, we are only on track to be solving this problem for 1%. But we need to do more together. Our attention is now focused on how we use Rwanda as a model to tackle the problem globally and solve it for the other 99% of the population who need it. Thank you.
Thank you, Joseph, for that.
Thank you, Laura. Yeah.
Thank you for that compelling presentation. I'm sure we will have lots of people asking questions in the question and answer session. I understand that Dr. Katari is with us. Dr. Katari, are you able to connect? If so, I would like to go through your presentation about blood services in Rwanda. Great.
Can you hear me now?
Yes, thank you. Welcome. We're so glad.
Thank you so much.
All right, go ahead.
Greetings, everyone. I'm sorry for joining late. I had some connectivity issues, but I'm finally here. So my name is Dr. Katare Swaib. I'm head of the National Blood Service, and I hold an BCHB with specialization in transfusion medicine, and immunohematology. Next slide. So happy to be here with you, and I'm going to be talking about Rwanda's system, blood banking system, and I'm going to give you a brief on the background of the National Blood Services, our mission, our current situation, and also I'm going to complement on what my colleague Joseph has just given you, which is the use of drones to distribute blood and blood products. And I'll also end my presentation with what we are aiming at in the near future. Next slide. Yeah, the National Blood Services in Rwanda is the only institution mandated by the government of Rwanda to ensure and oversee blood safety in the country. And our mission is to provide safe, effective, and adequate blood and blood products to all patients in need. And to ensure geographical accessibility to blood, 5 regional blood banks have been set up in all the 5, in each of the 5 regional provinces of Rwanda. And we have true drone pods that have been set up to facilitate distribution, especially to the remote hospitals. And we have a total staff of 114 staff on government structure, plus 32 supported by the Global Fund, making it a total of 146 staff. Countrywide, we serve 71 health facilities. As I mentioned, we are the only institution, and this means all the 71 are from public or private settings. So I've been able to set up permanent mobile blood collection sites, totaling to 568, and these are located in the universities, in the high schools, in villages, and other public and private institutions. So next. Yeah, our blood banking system can be summarized in 5 spheres. One, we deal with donor mobilization, recruitment, and retention. And ever since the current administration took over, we've been able to mobilize and broaden our donor base from 25,000 blood donors to currently over 47,000 blood donors. And this includes our armed forces, which are the Rwanda Defense Forces and the Rwanda National Police, who actively donate blood and played a very pivotal role in ensuring blood supply in the country. Number two, we have a donor selection, which is based on 100% voluntary, non-remunerated blood donors. And Rwanda is one of the only 10 countries in Africa with such a program of 100% voluntary, non-remunerated blood donation system. We have a donor notification program whereby all our donors are notified of their sero statuses, and those who are reactive for any TTI marker are called 2 to 3 days prior to the notification day to ensure that they come for notification and pick their results. And we also refer them officially to the nearest health facility for care and treatment. And number four, to ensure quality and efficiency, we have centralized our operations, majorly in two areas, which are testing and components production. And today we exclusively distribute blood components to the hospitals, and we distribute red cells, platelets, FFP, and cryoprecipitate antihemophilic factor. We have both testing and component production fully automated to eliminate any human errors that can arise. We also have, in number 5, we also have a centralized IT architecture, which helps us to ensure 100% donor and patient traceability, plus also a nationwide supply chain visibility, and we can trace blood and blood donors from time to time. Then number 6, we have in place an electronic system that helps us to monitor our cold chain. We also have an online hemovigilance system, which we use to monitor the utilization of blood by the hospitals. And as I mentioned, we use drones for distribution of blood, currently to 25 hospitals out of the 71. So with this kind of system, we are able to meet the hospital demand at a rate of 96%. And before we go to the next slide, I would like to mention that Rwanda and Namibia are the only 2 countries that have been able to achieve the topmost level, which is the step 3 of the Africa Society for Blood Transfusion accreditation. And due to our well-performing system, Rwanda is a host of the first of a kind AFSBT Collaboration Center, and we are also happy recipients of a certificate of commendation from the International Society of Blood Transfusion on 3rd June 2018 at the ISBT Congress in Toronto, Canada. Next. Yeah, we've been able to raise and increase our hospital satisfaction from 49% in February 2014, when the current administration took over from the previous administration. And currently, as I mentioned, we satisfy the hospitals at a tune of 96%. Next. Yeah, as in terms of empowering the hospitals, the hospital physicians and other staff, we've been able to revise and distributed the national guidelines on rational blood utilization. We developed, distributed and trained our hospital staff on massive blood transfusion protocol that we developed. And this has been key in management of massive hemorrhage, including such situations as postpartum hemorrhage. We also conduct periodic trainings, and we follow up the trainings with supervisions. and mentorship to all hospital staff on best transfusion practices. We have also created hospital transfusion committees as a measure to ensure hemovigilance. Next. Yeah, Rwanda has been making progress in different sectors, and within the health sector, we have got different innovations that which many countries have been coming to borrow a leaf from. And within the blood banking, we've had the list on your left. These are countries that have come to Rwanda for study tours to borrow a leaf from our blood banking system. Next. Yeah, I talked about delivery of blood using drones. And I would like to mention that before we introduced the drones, the health facilities were responsible for picking up blood from the National Center for Blood Transfusion using their own vehicles. And the hospitals could only stock Rh positive packed red cells and could make periodic and routine trips to a nearby regional center for blood transfusion to replenish their stock. And the Rh positive packed red blood cells represented 73.3% of the total blood products. And the demand for such Rh negative packed red cells like FFP, platelets, and cryoprecipitate required emergency trips to pick up whenever there was a necessity for the blood products. And this represented about 22% of the total blood products. So because of those logistical issues and the staff were not enough to cater for the pickup of blood products, the government looked for an efficient way of ensuring that blood gets to the patient that needs it. Next. Yeah, so because of the logistical issues by the hospitals, we realized that we had wastages which range between 6 and 8%, especially in the rural settings. And putting in mind that a blood unit in Rwanda costs about $88 to be ready, this 6 to 8% of wastage in the hospitals amounted to huge sums of money in loss. There was also time wastage between a hospital needing blood and getting blood supplied. And this time ranged between 2 to 4 hours. And also the capacity was a very big challenge as the facilities only had few vehicles and routinely picking up blood tied up the capacity of those vehicles for both the vehicle and the staff members assigned to the task. So the government of Rwanda, as I mentioned, looked for efficiency and looked at using drones to deliver blood units to the health facilities as an alternative. Next. Next, Laura. Okay. Next. So I've been able to eliminate stockouts. We've been able to cut down on the turnaround time and also ensured universal access to high quality medical products, as Joseph mentioned, but also blood. Next. Yeah, with the drone deliveries, we've been able to improve access to blood products, as I mentioned. We have improved standard of healthcare. As I mentioned, we are currently serving 25 out of the 71 health facilities. And we have been able to reduce waste from 6 to 8% to 0.3% currently. And I would also like to mention that 40% of all deliveries are emergency deliveries. Next. Yeah, this is an article in the local newspaper, the New Times, whereby 3 district hospitals we're able to achieve 0 maternal deaths, and largely this can be attributed to zipline. Next. Yeah, I think Joseph mentioned this. Between 2016 and 2018, we were serving 20 hospitals, and currently we are serving 25 hospitals with blood. Next. Next. Yeah, this is where we want to be with the introduction of essential medicines. We shall be able to cover up to 500 health facilities, including the health centers. Next. Yeah, as for challenges, as any other blood service in Africa, we are faced with budget limitations. However, we are not, we are keeping the frame burning. Next. And we would like to have to introduce new like income generation. We would like to start generating some income through plasma fractionation. We are introducing this year leuko reduction, which is going to be systematic for all blood units we issue to the hospitals. Want to introduce antibody identification. Want to introduce nucleic acid testing, pathogen inactivation, and also ISBT 128 labeling system, which is internationally recognized. We also want to reach out to the city dwellers to also turn up to donate blood using these blood donation buses, and we are looking at introducing this bus sometime end this year or early next year. Next. So I want to thank you all for your kind attention. I think details will be coming up in the questions that might be, some of you might be having. Thank you.
Thank you, Dr. Katari, for that look at the Rwandan national blood supply. You really showed us all the impressive gains that have been made, and it shows a model for other countries. And I think in the question and answer session, we'll hear more questions from other countries about that Rwandan experience. I'd like to now open it up for questions. You can type your question into the question and answer chat. We'll start. We have a couple questions that have already come in. We'll start with a question for Joseph from Zipline. The question is from Nancy Kadula. She says, how do you ensure that you always have the requested products? For example, some blood groups are rare. Is the turnaround time increased in case the facility needs this rare blood type like O negative?
Yes, thank you for the question. So the Zipline handles the logistics part of the equation. We still work very, very closely with the National Center for Blood Transfusion for availability of the supply. So what the contribution that we make to that is, if those rare products are available, we can make sure that they are centralized so that they're not stocked at one hospital when they are needed at a different location.
Great, thank you. And we have a question for Dr. Katari. This is from Jane Briggs. It's two parts. She says, could you talk about the regulatory framework in Rwanda for blood products? This was mentioned by WHO as a weak area in many countries. And also, could you talk about the cost of the Zipline? Does each hospital pay for each delivery, or does the MOH have a contract and pay at the central level? Is the increased cost of this type of delivery offset by reduced wastage that you described?
Thank you so much. On the first question, Rwanda is still looking at ways of setting up an NRA in the meantime. The National Center for Blood Transfusion is responsible for all blood-related activities in the country. Number two, for the question about how much we pay, whether each hospital pays a fee for the delivery, it is the government of Rwanda that pays. We have a contract with Zipline, and we pay a flat fee of about 20,000 per month but this keeps on increasing as more products and more hospitals are enrolled into the system.
Thank you. And back to Joseph, are your prices charged to the Rwandan Health Services all real costs, or are your costs subsidized?
Right now, our costs are subsidized. We have the company started in the US and has been funded by venture capitalists. But our vision in the future is that we will be able to extend to enough customers and optimize our operations enough that we can, the operations in different countries where we are planning to work can be self-sustaining.
And to Dr. Yuyun, you very clearly outline challenges in blood services. How would you advise a country who struggles with many of these challenges how to prioritize which ones to address first?
Thank you for the question. So indeed, the country need to do the self-assessment first, and then try to find out what is the most obstacles on blood services in the country, and then put it in the priority. And then you can use the action framework to see what kind of activity need to be done to, to address these challenges. So I think we already described all the activities for each strategic objective in the action framework. So it's indeed it's depend on the priority problem in the country. Then you can use the action framework to guide you to overcome the problem. Thank you.
Thank you for that answer. And another question for Zipline. For blood products, where is the cross-matching done? This is asked by Swaraj Rajmandari from Nepal.
Excuse me, can you please repeat the question?
For blood products, cross-matching.
I can answer to this. I can answer this.
Go ahead, Dr. Qatari.
Yeah, so the way the system operates is that we do the cross-match, we do the we do the testing, we do the component production, and then issue
Dr. Qatari, I think we lost your audio. While we wait for the connection back, Joseph, did you want to help answer this question?
Yes. So like Dr. Swaibu was saying, everything that has to do with production and testing and the actual utilization of blood, we work closely with the National Center for Blood Transfusion because they are the entity that has the expertise. And if the hospital has any questions or they need to return the blood or do additional testing on the blood, we make sure they get connected promptly with the National Center for Blood Transfusion. Yes, so that everything else happens either at the hospital or at the National Center for Blood Transfusion.
Thank you. And as we approach the end of our time, I just wanted to, our last question is actually a compliment for the presenters from Milkadina, which says nice combination of presentations and videos. So I'd like to thank our three presenters for their presentations and for answering all these questions. I think this was a really robust session, and I'd like to now pass it back to John for the information on the breakout sessions. Thank you, everyone.
Thank you, Laura.
Thank you, Laura. Bye-bye.
Yeah.